Welcome back to my channel. As you have guessed it from the title already, that this video is going to be about indirect retainer. Apart from the concept of indirect retainer, there's so much more that we'll discuss in this video. Making RPD designs for different cases isn't that easy. However, this concept will surely stimulate the gray matter of yours. So yeah, let's get started. In the third year or final year of your prosto postings, you might have delivered a complete denture or even a removable partial denture. So what you see in the illustration is the first picture of acrylic partial denture, where you have an acrylic part and artificial teeth on it. And these are also called as gum strippers because they cause gingival recession. We also have cast partial denture where we have a metal framework and acrylic part with artificial teeth on it. And comparatively, this has more retention than the acrylic partial denture. But cast partial denture requires a lot of designing, which we'll discuss in the video. Indirect retention is one such part of this removable partial denture. The component of removable partial denture that assists the direct retainer in preventing displacement of the distal extension denture base by functioning through lever action on opposite side of fulcrum line when the denture base moves away from the tissues in pure rotation around the fulcrum line. You might wonder, why is it that indirect retainers are only given in cases of Kennedy's class 1 and 2 or distal extension cases? I mean, what makes these cases so distinct? Kennedy's class 1 and 2 or distal extension case or two tissue supported dentures, here we have a lot of tissue. The stress distribution in Kennedy's class 1 and 2 is different because the tissue compressibility or displaceability here is more. Hence, this puts a lot of stress on the abutment tooth. The stress distribution is different for the tooth and the tissue. The tissues, they get compressed or displaced, whereas in Kennedy's class 3 we have abutment teeth on either side of the edentulous area, hence that is tooth supported RPD. So the stress is distributed on those teeth and well tolerated. That is, vertical forces are generated, and if you see in the diagram that vertical forces are better tolerated by PDL, but horizontal or off vertical forces are not. If you see here in the middle illustration, you see there's a denture in pink. So what happens is this generates off vertical or horizontal forces on the abutment teeth near it, due to which it tilts. We'll discuss as we move ahead with the video. So this distal extension cases, they generate off vertical or horizontal forces, which is detrimental to the abutment teeth. Abutment tooth is the one which is adjacent to the edentulous area. This is the reason why we need indirect retainer in Kennedy's class 1 and 2, because it derives primary support from tissues and secondary support from abutment teeth. And in Kennedy's class 3, it derives all its support from the abutment teeth. You get a long answer question on this where you have to justify as to why indirect retainers are needed in Kennedy's class 1 and 2 or distal extension cases. So this is a very important concept and I urge you all to do not skip any part of this video. Let us understand in brief what indirect retainers are and how and where they are placed. So they can be auxiliary occlusal rest, auxiliary, that is extra, apart from those placed on the abutment teeth, the extra occlusal rest. They can be the rest seat on canine, that is canine rest, canine extensions from occlusal rest. Lingual plating can be done. Actually, lingual plate is not indirect retainer, but at times we can do lingual plating. Then modification areas, that is occlusal rest on secondary abutment in class 2 partial denture, can serve as indirect retainer too, or full palatal coverages. Indirect retainer is placed as far from the primary fulcrum line as possible, and it is at 90 degrees to the fulcrum line. Fulcrum line is an imaginary line around which the RPD tends to rotate because, soft tissues, they displace more, so rotation will arise here. And fulcrum line is between the two most posterior rests. The most posterior abutment, if you pass a line across them, that is this pink colored fulcrum line you see in the last picture, perpendicular to that, that is yellow color line, depicts the position of indirect retainer. When the patient will bite on this denture, because soft tissues are displaceable, they will get displaced, so rotation will arise here. And thus this denture will rotate around the pink color fulcrum line, which is imaginary. Hence, to avoid that, we give indirect retainer. Incisors are not used as abutment teeth. Hence, usually, nearest canine or mesioclusal surface of first premolar is considered the best location for indirect retainer, but this varies with every case. While designing RPT cases, first draw this imaginary fulcrum line across the most posterior abutment teeth, and perpendicular to this fulcrum line will place our indirect retainer. Here we have given mesial auxiliary occlusal rest as indirect retainer. Why mesial? We'll get to it as we go ahead with the video. I intend to make a separate video on biomechanics in RPT, but for now we'll just discuss this lever mechanism or lever principle because this principle helps us design better RPTs. There are three types of lever based on location of fulcrum, resistance, and direction of force, that is, effort. In class 1 lever, we have fulcrum in the center and resistance and effort on either side of fulcrum. If we, considering this lever 1, we design our RPD, in the first image you can see, we have a denture and the effort, that is biting forces, will cause the tissues to compress or displace, which will make this denture rotate, as this distal rest here on the second premolar will act as an axis of rotation, and along which this denture will rotate. All these forces will get transmitted to the abutment tooth. This will lead to bone loss in future, and thus we avoid this lever 1 design in RPD. More precisely, in distal extension case, where we apply class 2 lever principle. In class 2 lever design, we have fulcrum on one side, effort on the other, and resistance in the center. So when effort biting forces displace this denture, we have placed fulcrum far away from it, that is mesial rest. And resistance arm here is almost equal to effort arm, and thus occlusal load is less compared to class 1 lever design. We'll understand this in detail as we are moving ahead to the most important topic of this video. And coming back to this, class 3 lever design is for the tooth supported RPD. The real reason why we use indirect retainer in Kennedy's class 1 and 2 and why we place a mesial rest when we have a distal extension case, that is Kennedy's class 1 and 2. Most importantly, if you get a question on indirect retainer or when you have to justify the use of indirect retainer in Kennedy's class 1 and 2, you must draw these 4 illustrations. If we use class 1 lever design in distal extension case, or say we place a distal rest, the distal rest will act as axis of rotation, and due to the effort or occlusal forces, the tissue displaceability is more, as this denture will displace the tissues and they'll get compressed. This will produce this horizontal or off vertical forces and cause the tipping of the root of the abutment tooth, and it will shift from A to A dash. Thus, there will be distal tipping of abutment tooth, which will lead to an open contact between the adjacent tooth and abutment tooth. Horizontal forces or off vertical forces are most detrimental to the abutment tooth and lead to bone loss in future. In the second picture, you can see if we give a distal rest or the rest which is adjacent to edentulous area, especially in Kennedy's class 1 and 2 cases, that is distal extension case, the distal tipping of the crown of this abutment tooth will take place, and this will lead to open contact between the third picture is depicting the same thing, that is due to distal rest, thus there will be off vertical or horizontal forces which will cause distal tipping of the abutment tooth, as this rest is acting as a axis of rotation. In the fourth picture is the real reason why we place a mesial rest or indirect retainer, because the forces directed are more in vertical direction here, because axis of rotation is far away from the denture. This point you must consider whenever you are designing RPD for Kennedy's class 1 and 2. This is very important. When we design RPD, we usually place the rest on the adjacent tooth, the tooth adjacent to the edentulous areas. But when you get a case of Kennedy's class 1 and 2, you will place mesial rest. Due to mesial rest, the occlusal load on abutment tooth is decreased because some of the forces are transmitted to the adjacent tooth as well. Those were some basic things about indirect retainer that you must know, and this will really help you while designing RPD. I'll come up with more videos on this. And And you know the drill. If you like this video, do subscribe and share with your batchmates. Thank you.